We'll move on to our next speaker, who was a former Assistant Surgeon General of the United States and has had a lifelong career in public health. Richard Lemon. Go ahead, Richard.
Hello, and let me also welcome all of you to ADASO's annual conference. I am Richard Lemon, co-chair of the Asbestos Disease Awareness Organization Science Advisory Board, along with my good friend and colleague, Dr. Arthur Frank. I have researched the epidemiology of asbestos-related diseases for the past 51 years. And as Brad said, I'm a former Assistant Surgeon General of the United States, as well as the former acting director and deputy director of the National Institute for Occupational Safety and Health. We are all here today to support a ban on asbestos in the United States. The Alan Reinstein Ban Asbestos Now bill will represent a monumental public health achievement for the United States and its citizens by preventing asbestos-related disease to all of our citizens. Asbestos is a killer. It often kills in what appears to be a random pattern, affecting one and leaving another unharmed, even though they have similar exposures. We do not know why this happens, but it probably has to do with individual susceptibility or other circumstances unknown to science today. We do know that asbestos-related diseases are dose-response diseases, and as doses increase, the risk of developing asbestos-related disease increases. We also know that there has not been a dose, as Linda said earlier, identified below which some individuals are still not at risk of developing disease. As we attend this conference today, approximately 110 persons throughout the day will succumb to an asbestos-related disease. As Linda said, that's approximately 40,000 Americans will continue to die each year until a ban is enacted. Every one of these deaths are preventable. Unfortunately, these numbers represent only an estimate and are one that is clearly an underestimate because there are no nationwide surveillance systems in the United States that adequately capture the true nature of asbestos-related diseases. Let me give you an example. One of our premier surveillance systems, the Surveillance Epidemiology and End Results Database, often referred to as SEER of the National Cancer Institute, has been found to underreport mesothelioma in some areas by as much as 80%. I am glad this bill provides language to address these deficiencies so that we will eventually have data to measure the true impact of asbestos and to determine if our public health efforts to prevent asbestos-related diseases are effective. As we see in countries that have banned or placed strict regulations on the import and use of asbestos, the trend of asbestos-related diseases is beginning to slow down. However, that is not true in the United States, who has yet to take the action to ban asbestos. While this country is still experiencing an asbestos disease epidemic, that continues to grow. It is shifting from occupational to non-occupational exposed victims. It is clear that all forms of asbestos, including chrysotile, which some call the safe form of asbestos, cause each of the several asbestos-related diseases. Proponents for the continued use of asbestos, however, argue that chrysotile does not cause mesothelioma compared to the other commercial fiber types. Keep in mind that chrysotile represents the most commonly used asbestos today and historically represents over 95+% of asbestos usage. So no wonder proponents of asbestos don't want to ban chrysotile. I asked, is this an argument? Is it scientific or economic based? I think we know the answer to that. I am pleased the Alan Reinstein Ban Asbestos Now bill makes no distinction and includes all commercial fiber types. And it also addresses the legacy of asbestos still in place in the US in buildings, schools, hospitals, and multiple commercial products, as we heard earlier. Passage of this bill will mean an asbestos-free America. And I can't say that enough. We want an asbestos-free America. Now let me switch gears for just a minute. I want to stress the need for regulatory agencies to change their counting methods for enforcement of including only asbestos fibers greater than 5 microns in length, because scientific data show that the vast majority of asbestos fibers are less than 5 microns in length. In fact, studies by NIOSH, the agency I used to lead, show this can be as high as 90%. Why is this important? It has been found by multiple researchers in pathological studies that fibers most likely to penetrate into the lung tissue and move to the areas where mesothelioma occurs are the short fibers. Additional studies by NIOSH on a cohort of textile workers predominantly exposed to chrysotile in South Carolina has added new information showing cumulative exposure to fiber sizes, including those less than 5 microns in length, were highly statistically significant predictors of lung cancer or asbestosis mortality. In summary, science has not exonerated fibers below 5 microns in length as a health risk, and on the contrary, what science tells us would indicate the opposite. Thus, it is time for regulatory agencies to reevaluate their sampling methods to address these short fibers of asbestos. Now I'd like to close my comments and thank you very much.
Thank you, Richard.